I'm Dr. Ed Weisbart, and I'm here to talk to you about how liberals and conservatives miscommunicate and could maybe do a better job communicating with each other. In particular, I spent a long time mainly talking with liberals, my friends, and when I started reaching out more to conservatives, I didn't realize how many of the things I was saying were inadvertently really alienating and distancing them from my message and eroding my ability to say the things to communicate the things I wanted to communicate. So I've studied this a little bit, and there's a few models about how minds work that have really helped me better understand how to communicate my messages better, and I'm here to try to show that to you. So I'll go through a few of those, and we'll occasionally use single-payer healthcare as an example, because that's where most of my background is. This is not a treatise about single-payer. It's not about what you think about that. It's more about how conservative and liberal minds think, but we'll talk a bit about single-payer. So my background is that I'm a family physician. I practiced medicine in Chicago for 20 years, delivering babies and taking care of older folks and everything in between. And then I moved to St. Louis in 2003 and began volunteering at safety net clinics in St. Louis and elsewhere around the country. So I do that at least once a week. I moved to St. Louis in 2003 to become Chief Medical Officer at Express Scripts, a now Fortune 50 company that manages the pharmacy benefit for lots of Americans. And I learned a lot about business from working there and retired from that in 2010. A couple of years later, I got very active in this organization, Physicians for a National Health Program. This is a group, national group started in 1987, now reaches about 20,000, more than 20,000 members. And in 2012, we put together the Missouri chapter of this group, and we now reach well over 2,000 people across Missouri. And in Missouri, since we have not expanded Medicaid as of the time of this filming, hopefully soon, we also fight for Medicaid expansion. So here's essentially how my mind works. I like to go to dinner, I like to eat dinner, I like to be in a restaurant. I like for all these reasons. What I don't like to do is this. I don't want to go to your kitchen. I don't want to hear all the details. I don't want to hear the background. That's me. Other people are the exact opposite way. So let's go to the example we're going to talk about, single-payer healthcare. A little primer about single-payer healthcare, a tiny bit, and for a very specific reason. So here's all of us, so to speak, and there's all the stuff we want. We want to go to the doctor, we want to go to the hospital at times, we want to get prescription medications, and in between the two of these things, between us and all these services, is the money, right? So how does the money get managed today? Today it gets managed by a lot of different organizations. The United States government, of course, pays for some of the healthcare. We pay the government through our taxes. The government pays doctors, hospitals, and such. So the United States government is one of the payers for the U.S., for the military, for the post office, and for lots of other groups. The United States government is one of the many payers. States, and our state, Missouri, is one of the payers. State employees, universities, cities are one of the payers. We have city employees who get health care paid for by the city and because of their hard work. Various universities, all of these groups. Businesses all around the country pay for health care for their employees. Their employees work and earn things, among which includes wages, or includes health care benefits. And then this wealth and insurance companies. This is what's called a multi-payer model. There's many payers in between the patient and the recipient. That's a multi-payer model. We're the only country in the world that does this. So that's what we have today. That's multi-payer, as opposed to a single payer, where instead of all of these groups organized in it, there's one organization that pays it, typically quasi-governmental, and it takes the money from taxes and then pays all these groups. That's what's called a single-payer healthcare system. That's also known as national health insurance. That's also known as Medicare for all. You may have found yourself confused by what these different words mean. What's the difference between single payer and Medicare for all? What's the difference? If you found that confusing, it's for a very simple reason. There is no difference. These are synonyms. These are synonyms. So depending on with whom you're speaking, one of these synonyms may make more sense than another. So let's unpack that a little bit. Single payer, what does that mean? What's a payer? Well, you know now, and most physicians know what a payer is because they submit bills and such, but I submit that most people don't know what a payer is. So the phrase single payer doesn't resonate. They don't understand it. They've heard it, but they don't really understand what a payer is. Or national health insurance. Some people hear that as the federal government taking over health care. So be a little thoughtful about how you talk about national health insurance. Or Medicare for all. Most seniors love Medicare, but there's some folks out there who just really are focused on the faults with Medicare. And so Medicare for All really is improved Medicare for All, but be careful about the choices of words. The choices of words really matters. The choices of words really matters. Here's an interesting survey done in 2008, right after President Obama was elected president. So they surveyed likely voters, which is why the numbers are high. They surveyed likely voters and asked one of two questions. Either how important is it to you to vote, or how important is it to you to be a voter? Those are almost the same thing. I might slip back and forth between those two without realizing it. Then they went back and saw, did you vote? How important is it to you to vote? Those people, 82%, again, likely voters, 82% of them voted. Small difference in words, how important is it to you to be a voter? Almost all of them. Tiny difference in words, huge impact in outcomes. So let's talk about one of these differences in words you could pick. Let's play a game. Obviously, we can't play a game, but let's play a game. We're going to toss a coin. And heads, you lose $10. Heads, you pay me $10. Tails, you win something. I pay you something. The question is, how big does tails have to be for you to want to play? So heads, you pay me $10. Tails, I pay you something. How much does tails have to be for you to say, yeah, I want to play? Think about it for a second. Most folks would say $20. The most common answer is $20, because losing what you have is much more meaningful to most of us than possibly gaining something that you don't really believe in. Losses count double gains in general. Losses count double those gains. And why am I telling you that? Well, let's think about how we talk about stuff. There's a gain-centric message, which I would tell you is a relatively weak say to say something. So you could say, save money. Let's put in a better system so you can save money for the other things that you want. That's a gain. You might be able to get other things. Gain-centric. Don't you want to be able to go see any doctor that you want? It's a gain-centric message. Compelling to some, but it's gain-centric. Live longer and healthier. Improve the healthcare system so you can live a longer and healthier life. These are gain-centric messages. Very nice, but they're gain-centric. I would submit to you can be more powerful with a loss-centric message. Stop wasting your money. It's your money. Why are you wasting it? Stop wasting. You don't have money to burn, so stop wasting your money is much more potent than saved money. Why should insurance companies get to pick your doctor? It's yours, and they've taken away that choice. Why should somebody else get to pick your doctor? Or don't die younger than you need to. Live longer, that's gain-centric. Don't die younger than you need to. That's a loss-centric message. You have to deliver it nicely, but that's loss-centric. Here's an example that you can probably relate to. You have a choice of 3 surgeons. This one says, I want to do your operation, and I've got a 95% chance of success at this operation. This other one says, I want to do your surgery, and I've got a 5% chance of failure. Well, which one are you going to pick? I don't know about you, I'm going to this one. I want the one that's got a positive chance of success. And you know, arithmetically, these are identical, but this is much more attractive than that. Actually, that's what's called loss aversion. We don't like that. But sadly, we usually don't have any idea what the outcomes are. Let me tell you one of the models of how brains work. This is from a psychologist, Manny Elkin. He calls it the whole brain model. And he says we all have one of 4 comfort zones. One of 4 comfort zones. And some of us, of course, have all 4 of these, but to divide it up into 4 major groups. One group really likes the facts. They really like the facts. It's got to be, tell me the numbers. What are the financials? Show me that number's not right. Show me the numbers. Show me this. Show me them. How are you going to measure this? Some people, this is what really matters. Other people, really what I care about is how are you going to do it? What's the form? What's the process? How are you going to regulate this? How are you going to know you made it work right? The form really matters to them. Some people, none of that's important. It's this. It's where are we going? Until you tell me where we're going, why do I care what the facts and process is? I got to know where we're going. If there's no reason to go there, so this might be important. And then there's a group that is all about the feelings. How does this make me feel? Who are you talking about? I need the face of a person. Tell me a real person that you're talking about. I get this nice theory, but tell me a real story, an anecdote, a person. Put a face on this. So we all have some of each of these, of course, but some of us are much more in one quadrant than in the others. The point is that you need to know to whom you're speaking when you're trying to be compelling. It's very easy to have a comfort zone of your own and only speak to the comfort zone that you're in, but you need to do more than that. You need to get outside of your comfort zone and try to use the kind of argument that somebody other than yourself might find important. So there's that. Find the common ground. there's things that we say that we don't realize are so off-putting. And here's one of my favorites. Healthcare is a human right. Resonates great with me, but I'm a professed liberal. Healthcare is a human right. Makes a lot of sense. So liberals, like me, when you hear that phrase, you hear equal opportunity, fairness, nurturing. Healthcare is a right, not a privilege. We hear those things, right? And that makes sense to us, and I'll show you why in a few minutes. Conservatives, however, might be hearing this. They might be hearing healthcare is a human right. Well, that sounds to me like government getting involved in stuff they shouldn't be. That's government overreach. They hear, I got mine, bub, and now you want to give it to everybody? Maybe that's okay, but isn't my line going to get longer to get to see my doctor? I'm worried about that. And then you're going to disrupt my health by doing that. It's a moral hazard. You're giving people a right, and then they're going to start overusing the system. You've eroded the nature of society and undermined individual responsibility, and that's more important than anything else you can talk about. These seem like we're at odds. We think that conservatives are just heartless and they don't care, and conservatives think our bleeding hearts are going to destroy the country. How do we get together on these things? Well, it turns out that there's actually quite a bit of common ground, and we just need to find it on whatever issue we're talking about. For healthcare, we could talk about the fact that we've already decided as a society that if you go into kidney failure and you're going to die because of that, we don't want to let you die because of that, almost always. And so we're going to make sure that if you have kidney failure, you're going to get dialysis. And that's one of the criteria for getting Medicare today, because we've decided that. So if we're going to pay for dialysis at about $75,000 a year, that's fine, we should do that. But I would rather pay $35 for a bottle of insulin every month to keep you from dialysis for a while, to keep that. Even if we just push it off by a few years, we're saving money by doing that. It's more prudent. If you're willing to walk away from the person and let them die, I can't help you. I can't get through to you. We'll talk about that in just a moment, who that is. Some do that. But most people, no. If you're having a heart attack, we're going to treat you, and then we'll figure it out. So if you're willing to do that, let's be a more prudent and delay or prevent those problems. Prudence, common ground. Bureaucracy is wasteful. You know, pretty much everybody says, yeah, well, needless bureaucracy, I don't want to waste money. The free market should apply to healthcare. It doesn't apply today. Most people in the United States have at best 3 insurance companies they can pick from, and those insurance companies pick your doctor and your hospital to a certain degree, or certainly limit your choices on that. So the free market in healthcare today is really being eroded by this insurance monster we put in place. Instead, the free market should apply to you picking the doctor and hospital that you want and not having to go to look at some insurance company's directory. The free market should apply to doctors and hospitals competing with each other to attract you to get the best health care you can. That's where the free market's role is, and that's a common ground again. The best health care in the world, efficiently delivered. My attempt to make a single phrase that summarizes this whole line of reasoning. So, if you don't know George Lakoff, shame on you. You need to know George Lakoff. He's the foundational research in a book called Moral Politics. He's a neurolinguist from Stanford. And he said, very interesting thing, he said that conservatives value these kinds of things. And I spent most of my life struggling with this. These things seemed somewhat inconsistent to me, and I struggled to understand how somebody could have these priorities all at the same time. I didn't understand that. And that liberals value these things. And he said that independents are often thought of as being uninformed or having no real opinion about stuff. So 3 groups. Now what he says is that this group, and the most extreme form, is what he calls a strict father model, a strict father, in his terms. So he says it's very hierarchical, that the most arch conservatives, the most extreme conservatives think of a hierarchy of God, man, woman, child, plant, animal, plant, rock. So that there's this hierarchy that's natural law, and that it's morally driven, and that if we as a society make decisions that undermine that hierarchy, we are damaging our moral value as a country and leading essentially to societal collapse. So this is what this group thinks. He calls that the strict father. He also calls this the nurturing mother. And this is the core value of fairness and equality, that civilization is interdependent, that we don't know where the next Beethoven or Mozart's going to come from. So we need to make sure that whoever that is gets a level playing field. And he doesn't say that these people have no opinion. He says that they're biconceptual, that they have this frame in their head and they have this frame in their head, that they have both of these frames in their head. It's not that they don't have an opinion, it's that they actually are carrying all of these opinions at the same time. So the important thing is that learning something requires this frame to be active. If you don't have the frame active in your head, if you don't have the frame active, you're not going to hear information or narratives that are designed to apply to that frame. So the important part is that only 20% of people have isolated this as the only way they think, and only 20% of people have this as the only way they think. Most people, more than half, have both frames in their head at the same time. Most people are both strict father, they get the hierarchy, they or to some degree, some version of that, and they believe in authority, but they also believe in this sense of a level playing field. And the key is that if you're talking to this person, and you figure out that it's this person, give up, walk away. You're not going to persuade this person. But most people you're going to talk to are this group. So your challenge, your task, is to try to activate this part of their brain early in the discussion. Think of something that makes them want to nurture. Talk about their mother, ask them about their grandparents, ask them about their kids. Something that makes them want to nurture. No frame, no learning, so activate the frame that's going to work to you. So there's that. This is a little more recent research. Jonathan Haidt, spectacular book. He did a survey of 132,000 Americans, probably more by the time you're watching this, 132,000 Americans online. And he identified what he called 5 core moral values, 5 core moral values. And he scores individuals how much this value is important to you, or maybe you reject this value. He scores 130,000 people, and at the same time, he has assessed their political standing. Are you conservative? Are you liberal? Where do you stand along that spectrum? And he compares these things. And it's very interesting. So here we have very liberals tend to strongly endorse this first of the 5 moral values. They tend to strongly endorse fairness. That's really important to liberals. So reciprocal altruism. I'm doing good for you because I know you're going to do good for me if we keep this society going. That's reciprocal altruism. I believe in justice and fairness. That's the core value of fairness, and we on the left tend to really value this. We also tend to really value caring, doing no harm, understanding each other, being gentle, kindness, nurturing. These are our 2 biggest, most important endorsed moral values. But there are other moral values. Loyalty, patriotism, one for all for one, especially to your community. What is your community? How big is your community? That's a question. But loyalty is another important value, not as important as these other values are to the very liberal. So, and then authority, deference to leadership, respect for traditions, perhaps faith-based approaches. Again, not as strong on this side. And then lastly, sanctity, that my body is a temple, and if I do something immoral or drugs or something, that's going to damage my body's sanctity. Sanctity is actually generally sort of rejected as a core moral value from the most liberal folks. And of course, there's plenty of exceptions, but here's the spectrum. What's interesting is that it's different as you go across the political spectrum. So conservatives, the very conservatives, of course have some concern for fairness. They don't reject fairness, but nowhere near as potent as it is on this side as a core moral value. Same thing with caring. They don't reject it, but it's not nearly as potent. These other values, however, are much higher on that side. So if you're over here, you're not making these arguments very often, and you're seeing these folks, and you're thinking, well, you don't really care. You're a cold-hearted, dispassionate person. How can you not care? Look at this. How can you not care? That's not fair. It's just not fair. Why doesn't fairness matter? It does matter, but they've got these other things that also matter. And if you're over there, looking over here, you're seeing this, the, quote, bleeding heart liberals, but you're not seeing any of this, and so you're rejecting. The point is, both sides have a strong moral foundation, and we tend to want to say to the other side, you just don't have any more. Where's your morals? How can you not? Don't be moralistic. Every person typically has a really strong set of morals. It just may not match up in priorities with yours. So there's that. How do you handle objections? You don't want to do this. You really don't want to do this. So this is not about good versus evil. You can get to the middle ground by either saying yes and, or you can get to the middle ground by saying no. This will tend to build consensus. This will tend to make somebody defensive. So you don't want to do that very much. You're going to get to the same place. You can get there by saying yes and, or by saying no, but
No, you want to go this way. So what is a no but? I hear you, but let me tell you the facts. You know, all of these kinds of, here's why you're wrong. These are the things that make the person you're talking to defensive. They're not going to agree with you. You put them in a corner. Other things don't paint people in corners. Help me understand. That's help me. That doesn't alienate as much. You know, you're right. And you could probably find something about what they're saying that you actually do think, you know, you're right about such and such, and that makes me think that, or what do you think about this part of what I'm saying? Again, I'm trying to get to the same ideas. So, a former FBI hostage negotiator, Gary Nestor, sort of made this point where he said, be humble. It'll not only make sense from what I just showed you, about not having the moral high ground, but also it's a good strategy. It's a good strategy. Now I'll just read this. The sincere and genuine demonstration of your interest and understanding of the other person's point of view is far more important than your ability to provide a quick answer. We tend to do that, right? We tend to hear a problem and jump to here's our solution. But really spend the time and listen to what it is the other person is saying. And you might actually learn something. This is perhaps another person who has a point of view on this, Jimmy Hoffa. I don't know how that worked out for him, but he said almost the same thing. He said the toes you step on today just might be connected to the butt you want to kiss tomorrow. So anyway, imagine that you've got to try to condense all the things I just said and all the issues that you're thinking about your political cause into 15 seconds, because you get on an elevator and lo and behold, this guy's there. And he says to you, hey, what are you thinking? So you've got to try to figure out how to condense your message out of the paragraphs and paragraphs that we like to ramble on about down to just a few seconds. So I'm going to give you an example of doing that in national health insurance, single payer. Here's one way to phrase it. I've already told you this. This is one way that I think doesn't alienate the people with whom you're trying to argue with. And that means these four things. No, cover everybody, no copays, stabilize the nation's costs, and see any doctor. These are sort of four key talking points thanks to Joe Sparks for summarizing it like this. So what does that mean? Cover everybody. Liberals would say, everybody in, nobody out. We've kind of alluded to this before. That taps fairness. Everybody in, nobody out. Resonates with me. But it doesn't resonate with everybody, as I think I've already explained. Healthcare is a human right. Again, tapping fairness. We'll live longer. Now, that's not a loss aversion framing that you already understand, but we'll live longer. That's caring. It's caring about things. Children, if your parents get sick, the children get sick, are in just as big trouble. So we need to provide healthcare for parents. Again, caring and fairness are two core values on the far left. Conservative messages would be sanctity. We should not die younger than we have to. We should not die younger than we have to because of our sanctity value. That's tapping into sanctity. All communities need healthcare. Your community, my community, all communities need healthcare. But the goal, of course, is to try to broaden community out to the whole country, or even broader. But all communities, focus on communities needing this to try to get loyalty. We tend to be loyal to our communities. And faith-based leaders are often strong advocates for access to healthcare and often have opinions that align with what you're trying to say. So think of a specific priest or a rabbi or whomever you're thinking of, or the president or some political leader or someone. Think of an authority who's on your side on this topic and try to tap into authority. That's cover everybody from a liberal versus a conservative point of view. How about no copays or deductibles? Liberals would say, you know, nobody should have to pick between paying the rent and getting their drugs. You shouldn't, or their medications. You shouldn't have to get evicted or have to not, nobody should have to make this terrible Sophie's choice. And that's because we have care as a core value. Your wealth shouldn't determine your health. It's just not fair that poorer folks don't have access to good, high-quality health care like everybody else. Your wealth should not determine your health. Well, that's a liberal core value of fairness. Conservatives might say, nobody should get sick because they can't afford to pay for care. Nobody should get sick. Focus on the sanctity, how preventable illness is a violation of the sanctity moral precept. Every American should be able to get health care. Loyalty, tapping again into loyalty. Every American should be able to. So, stabilize the nation's costs. Liberals here are wasting money for health care. It makes it harder to fund other important social programs. By squandering 31% of our health care dollar, as we do on the administration of health insurance, we erode our ability to pay for schools and keep the bridges up and running, and all these things that we think are important. We're eroding that because we have care as a core value, and we love to rail about how much money healthcare CEOs are making. Healthcare CEOs, they're grossly overpaid. We love to rail about this because we think that's unfair. We think it's unfair that somebody should be making so much money off of that. Again, fairness is one of our core values. Not as strong over there, as you saw. They certainly value fairness, but not in the same way. They might say, draining business resources through excessive insurance administration weakens our nation. Our nation is being undermined, less able to compete globally because we're just squandering so much money on the administration of healthcare. Again, tapping into the loyalty value. Be good stewards for our precious resources. Our resources, we need sanctity about that. Don't waste things. Or the last one, see any doctors. Liberals would say, insurance companies profit by limiting my choices, and that's not fair. It's not fair that they should be able to do that. Nobody should be able to tell me whom I can and can't see. You can't tell me that I can't go to that doctor, Mr. Insurance Company, because I reject your authority. We saw that on the extreme, liberals tend to reject this kind of authority. Conservatives might say, I need control over my own choice of physician because the sanctity issue. I need to protect my holy temple of my body. I need to have control over my choice of physician. Insurance companies should not contradict what my doctor says. Authority. So, our talking points, we showed you, we try to summarize it into one phrase so you can get that 15-second bit in. Try to have the isolated elements of what you think build your case. The last thing I would close you with is that I think we're actually at the moment that Winston Churchill was talking about. Winston Churchill once said, you can always count on Americans to do the right thing after they've tried everything else. We are at that moment in many of our issues. I'm Dr. Weisbart, and I hope this has helped. Thanks.